Moving on here, Sports Medicine Week. Dr. Cole, we got a great guest with us now here on the show. Darren Rovell, sports business analyst, the Action Network. He is a senior executive producer at the Action Network, and I've been listening and watching Darren for years. Spent 2 stints at ESPN, where he wrote for his own website and was on SportsCenter and Outside the Lines. Also been on ABC News, CNBC, where he anchored 5 prime-time documentaries, one swooshed inside Nike, nominated for an Emmy. So this guy's done it all, and he will be with us at the Hyatt Regency Chicago during our Chicago Sports Summit on October 2nd. That'll be a morning from 8 a.m. till noon at the Hyatt Regency. And Darren Rovell, thanks for joining us here on Sports Medicine Weekly.
Yeah, it's a pleasure to be here. It's going to be a great day. I think Dr. Andrews is going to be there. I mean, there's a lot of people who we want to hear from, so I'm excited.
Yeah, we're looking forward to hearing from you. You have an incredible background. Obviously, the panel that you'll be on will be the sports business betting and so forth. But I'd be really interested to know, from your perspective, the people now try to rely on the media even for things like fantasy sports and so forth. But this is going to go to a whole new level in terms of people trying to get the edge when it comes to getting the best information. Where's it going to land, and what do you see happening?
Yeah, I mean, obviously, whether you're going to bet on a team, there's players who are worth whole points to spreads. And, we all know about the history of certain teams like the Patriots, making people doubtful or probable, or at least injecting some sort of doubt into whether they're going to play or not, and then they play and they're fine, or they don't play at all. So there's 2 parts of this. There's one, which is, you look at Stefan Ubel at ESPN and having some sort of training into deducing what exactly is going on, what's happening based on an injury. Do we think that player is going to be in the game? Not. How much do the teams disclose? And frankly, how much should the leagues make the teams at least be more forthcoming? Do the leagues, when they are now selling data and doing sponsorship deals with sports betting companies and operators, do they have a obligation now to be a little bit more forthcoming? I'm not saying they're violating HIPAA laws, but I'm saying that, potentially the guise and the game of whether someone's playing or not should potentially go away.
See, the thing that's really interesting is, okay, so I will have the privilege of, for example, being at the point and place and time when an injury happens. I can see it happen. I can evaluate the player immediately. We can get an MRI, an X-ray, what have you, to substantiate the diagnosis. We can do our best to prognosticate or predict when an athlete's going to get back, and I can still be wrong. When you add all the filters that happen, there's always going to be HIPAA, privacy issues, and so forth. And I wonder what's going to – and I haven't thought a lot about this yet, and in preparation for the Sports Summit, which will be on October 2nd, I've been thinking a lot more. How close do you think media is going to get to getting any better information, and what are they going to do differently?
Media is going to get there, and then on top of that, it's going to be media will get there, and then on top of that, it'll be gambling guys trying to get inside. And I think what will change, certainly at the college level, because these guys are most compromisable because they don't make any money. I think the being able to see an injury, say in practice, or being up close to an injury, just being up close to plays and the players in general, some of those privileges are going to stop. I mean, it used to be, I'm sure, where, if you were a friend of a friend of a friend, you can get and watch a practice or get close. And I think, the handing out of badges on the sideline for people who are not, essential, or people who are, who could potentially be betting, I think some of that is going to go away, especially at the college level, because those guys are so compromisable. But, we'll see. I mean, at the Action Network, it is ridiculous what we go through basically we make a better. We're not touts or anything like that. We crunch the numbers like you've never seen. And there's people that pay at the high end $250 a month to say, okay, I have a theory that when it rains, the under hits, more than the over. So we have 25 years of data. And we can tell you when it's rained in a college football game in the last 25 years, what percentage of the time the under hits. And then we can tell you what games this week it will rain.
Interesting
So,
stuff.
It's fascinating.
It really is.
Yeah, and then there's a gazillion, but
data's come everywhere.
Yeah.
And as there's more money, I live in New Jersey, which is essentially Vegas East now. $3.1 billion was bet in the first 12 months of legalization. The 17th mobile app came out today, so I have 17 choices of where to bet. As the business gets bigger, there's going to be more want to find out more information.
Visiting with Darren Rovell, sports business analyst with the Action Network. I want to ask you this, Darren, with Dr. Cole here in the room. What should team doctors be aware of with this the future of legalized sports betting?
Well, I think there's the obvious. I mean, Darren, you probably.
Yeah, I think it's it's that beyond HIPAA laws. It's just information in general. You got to be really careful and who you're talking to.
Yeah, we've had mandatory training. Sorry, into that regard.
Be in a situation where you could be compromised, and the only similarity I have is when I was at CNBC, one of the things that we had to be careful. First of all, I couldn't own any individual stocks. But I also, let's say I was helping Jim Cramer with an Under Armour or Nike, and I knew that was going to be on his show in 3 hours. I couldn't let anyone know that was going to be on the show because that probably could have, if he was negatively talking about Under Armour and I knew about it 3 hours before, I mean, it's just everyone's got a lockdown.
Yeah. Well, let me ask you a question. If there's I'm trying to figure out how. So I know where I could be potentially compromised, and I know what I will do, and I'll probably be more silent than I have in the past. We're very careful about the things we say, and we rarely refer specifically to players and so forth, certainly with the teams we manage because of conflict. And frankly, these are our patients. They're not just players. They're our patients. But the interesting thing is, so I can see an injury, a player's out, but where the nuances will be is what's the guy going to be like when he returns? And that's why you have all these independent variables that you're looking at the weather and so forth. When you think about it, let's just take an ACL injury and a guy's going to be coming back to play first game, right? And there's literature. It's going to be fascinating because there's actually literature out there that can help guide you. Nothing is dispositive. Nothing's going to seal the deal definitively, but that's what gambling's all about. But you can maybe narrow the variability and say, look, I know that an athlete comes back, it takes X amount of time before he's throwing, consistently at 95 miles per hour after Tommy John surgery, and we know when those statistics, normalize.
Well, let me ask you this question: Are you so I know that things have changed a bit with there's the sponsorship angle too, which is kind of taken where most of the a lot of the relationships are either sponsored or whatever. But
right.
Are you considered a part of the team so that are you already locked up to not being able to gamble?
Yes, not zero gambling, but gambling anything. This is my understanding. Anything certainly related to what I do day in and day out. So that would be MLB or NBA. I would be
right. And is that per your guys, or is that per the team? You're not an employee of the team, so is that's your job as a doctor for who you work for, right?
Right. A league rule, Doc.
Yeah, the societies, the NBA society, the MLB society is extremely involved in this, and we have been, it's been couched in a very definitive way in terms of what we can and cannot do, and it would make sense that would be a conflict.
This is just one of the factors. I mean, I can't tell you, the things that I hear. Like one day in my office, the whole office was betting on Gary Woodland to lose his one-on-one matchup with whoever they had matched him up with. And I was like, "What are you guys doing?" And they're literally people betting thousands of dollars on Gary Woodland, who had just won the Masters,
U.S. Open,
but not the Masters, the U.S. Open, right? to lose this matchup. And I'm like, what are you guys doing? And they're like, his wife is like very close to labor, you know, very close, like within 24 hours. You know, if he bows out after once he starts, it's counted as a loss. And you know, obviously thinking about conjecture, like, you know, what his mind might be like and whatever, and the possibility that he would leave, you know, that was enough for people to spend thousands of dollars on. So
yeah, I mean, I'm trying to think of like if a doctor could be potentially in a very difficult position if you're sitting in the locker room and you're knowing who is or is not going to play, right, or who's going to play injured and it hasn't been disclosed to the media. So you could argue that a doctor could be in a very privileged position. I think, and so all of us know that, you know, this is just absolutely categorically off limits. And frankly, we're that way now.
Major League Baseball this year standardized the idea of when a lineup has to be submitted.
Yes.
And a lineup has to be submitted basically nationally at the same time.
Yes.
15 minutes before pitch, which is like there could be. We're now understanding that data has to be synchronized, and no one can have an advantage.
It's going to be fascinating, and it's going to be a moving target. But I think it's fascinating, really.
Yeah.
Darren, we got to move on. Great stuff. Darren Rovell, our guest, sports business analyst now with the Action Network, and Darren will be with us for the Chicago Sports Summit. Again, get your tickets at chicagosportsummit.com. Hyatt Regency Chicago, October 2nd from 8 a.m. till noon. Will be on the panel, A Future of Legalized Sports Betting. Great stuff, Darren. Thanks so much for joining us.
Thanks,
we'll
guys. See you in Chicago.
You got it. All righty. Let's take a break. Come back with our Ask the Doctor segment after this on Sports Medicine Weekly, only on
670 The Score.